I'm very happy to live here in the state of Utah except for the winter months. And we get these inversions which hold all of the trapped refinery air and exhaust and things, and we end up becoming a very dirty fishbowl. That's the only bad part about living here in Salt Lake, is that we get those inversions, but that's part of the heavy metal chemical toxicity that we're discussing. So this is a picture of me. How about that? We decided to make a change, and we got all decorated up. But I'm a chiropractic physician. I specialize in basically wellness and coaching others and other doctors how to coach others in wellness. I really enjoy my practice. 22 years now, and just very much. And I got to tell you, I just paid off my building today, so I'm quite happy to have a free, no more owing here on my practice. So that's a fun thing. Chemicals and heavy metals are found literally everywhere. They become concentrated due to human activity, whether that's going to be activity from plant, chemical processing plants, or anything that we do. We concentrate them, and then they become dangerous. Many of these improve the quality of life, health and well-being, but others, improperly handled, become dangerous and life-threatening. So some of the heavy metals are in our life, things that we use. Some are okay, but when they become concentrated, it's a big deal. So here now, the WHO, the World Health Organization's top 10 greatest concerns are air pollution, arsenic, asbestos, benzene, cadmium, dioxin and dioxin-like substances, inadequate or excess fluoride. Here in Utah, for some strange reason, we think that we really want to have our teeth great. And the Davis County, where I live, we've idiotically have voted for fluoride. Fluoride is a byproduct. It's very, very toxic, and how they're delivering it to us in our water system is just not appropriate. I've got patients who cannot touch or even have it on their skin, the water, or it'll make them break out and have rashing and so forth. My opinion was, if you wanted fluoride, go buy 1,000 fluoride capsules. They're very inexpensive, but don't make the rest of us have to have it in our water. So I guess there's two things about where I live that I don't like. Just the air and water. So anyway, lead. Lead's in paint. It's many different places. Mercury, of course. Mercury is in our amalgams. And I've had several dentists tell me, don't worry about the mercury. You know, we've done a lot of testing where we've put it into sheep and cow fillings, and we can't find any mercury anywhere in their body. Well, it's a heavy metal. It's my brother-in-law had a mercury stethoscope, not a stethoscope, but a sphygmometer on the wall in his practice, and he bumped it and it broke, and mercury fell out onto the carpet. And so he said, I better call just to make sure everything's okay. He called the poison control or wherever, and next thing you know, hazmat's there. The fire department came roaring with lights and sirens. Hazmat suits ripped his carpet up, and he had to replace the carpet. But literally, he had guys in hazmats getting sprayed off in the parking lot because of mercury. So I don't care. I don't like it in my teeth. So I've had all mine, actually, they've either fallen out or I've replaced them with the white fillings, the composites. Highly hazardous pesticides. So think of the pesticides we put on our foods. So heavy metals are a loosely defined group of elements and some semi-metallic elements that are properties with high atomic weight. Some in small amounts are necessary to support life. So zinc, copper, chromium, iron, these are considered heavy metals, but they're lower on the atomic element chart. So on the small amounts, those are essential. In large amounts, these and others become toxic, creating contaminated environments inside and outside of cells, causing tissue damage and cellular death. So when you look at it now, it looks like he's holding kryptonite here. I think that's what it almost looks like a lettuce leaf. So it's got to be kryptonite. So the most toxic heavy metals: arsenic, tungsten, nickel, beryllium, antimony, plutonium, cadmium, cesium, aluminum, and you can read the rest of the list. But this is everywhere. So you all remember back in our periodic table of elements how that worked. So heavy metals are found in every aspect of what we do. Auto exhaust, water supply, food supply, plastics, detergents, materials of all kinds have heavy metals in them. we've got to do things to get rid of the heavy metals out of us, and that's what we're going to be talking about tonight. And so happy that Inno-Vita has created the supplements that they have to help our bodies eliminate these most toxic issues. You got to love this picture here, heading out into the lake somewhere, and that's what we've got. It's just everywhere. So technically, everything is a chemical. When you think about how everything is created, plastics and carpet and paint and everything. So chemicals are commonly considered to be a compound that has been prepared, usually artificially. 75,000 chemicals are used in our commerce today. 75,000 chemicals. 1,000 new chemicals are introduced every year. Exposure to chemicals can have an additive or synergistic effect on the body. So they kind of compound and level or layer up on us. So long-term exposure can have cumulative effects and permanent effects leading to diseases, including new diseases not well understood. So you got to love this example here. Cigarette smoke is believed to contain over 4,000 chemicals. How is that possible? I can't imagine that they've actually used 4,000 chemicals to process it. Anyway, chemicals, 43 of which are known to be carcinogenic compounds. So it's interesting to me that for some reason I like the smell of a cigar or a pipe or a cigarette way off in the distance. Like if I'm at a football game and I get a little bit of a whiff of it, for some reason it's like, that kind of smells good. There must be some connection I've got. But when you get close to it, it just starts to, just be amazing how it can shut you down. And it's interesting, somebody who doesn't smoke a cigarette can do kinesiology where you have them hold a cigarette and in one hand and hold their arm out on the other, push on their arm, and it'll go immediately weak. It just drops them right out. But if you have somebody who smokes cigarettes hold their arm out, if they hold it, it becomes stronger. If they light it up and take a drag on it, their arm becomes even stronger. It's because they're satiating or giving themselves a hit of something that they're used to. So, I just can't believe that we actually smoke. And it usually starts when we're young, when we don't know better. And then it becomes a major habit. But even with smokers, there's things to do to help, to support. Permalung, for example, can help repair the lung tissue as we help that person diminish either quickly, a cold turkey, or slowly. We can help them quit smoking and get rid of those chemicals. So warning, most make the mistake in believing that their governments are protecting their health and that the environment from the adverse effects of toxic chemicals. Well, yeah, I'm not a conspiracy theorist, but yeah, I'm really definitely all about our government taking responsibility and helping us with that. Anyway, no, I don't trust them. There's too many people being paid off. So you have to educate yourself. So the U.S. government's list of top toxic chemicals, you can look through these, just tons. But we are in this soup of chemical. When exposed to heavy metals and chemicals, a natural response for the body is to try and store them in a safe place where they can remain and be excreted over time, thereby lessening the impact upon the nerves and other organs. So we'll do whatever we can. We'll shunt them into our fat supply, or we'll hold them in the liver. We'll do whatever we can to minimize the effect immediately. If we can detoxify it as it's coming into us, we will. But when it overloads us, we'll shunt them to different areas. However, many heavy metal deposits into tissue and bone. As cellular death occurs nearby, fungus attach and surround the heavy metal. This is very common that the fungus will wrap around heavy metal. I see it all the time in practice here, that when we're working on fungus, we have to consider working on heavy metals at the same time, and vice versa, because they kind of connect up. And we'll discuss that here in a minute. But you can look here, the different effects. Nerve damage from lead, particulate matter in the ozone that can affect the respiratory system. Volatile organic compounds that can create cancer risks and nausea and skin irritations and pesticides, and it's just everywhere. You think about it, early on, the Bible talks about people living into their 600s, 700s. We're actually supposed to live past our hundreds, but we live in a toxic environment that if we could live in a less toxic environment and eat clean organic foods and and take supplementation that helps us get rid of these chemicals and heavy metals, we would live a lot longer. Okay, so conditions are too numerous to list that are from heavy metals and chemicals, but the ones that we really think about: headaches, weakness, muscle and joint pain, tiredness, lethargy, constipation, behavioral issues, high blood pressure, kidney damage, memory and learning difficulties, miscarriage and decreased sperm counts, reduced IQ. That's what happened to me. I got too much darn heavy metal in my brain. Blindness, deafness, and brain damage. One of my patients came in and said, "Doc, I'm suffering from Dane Bramage." And I just went on and I thought, wait a minute, Dane Bramage. He had fallen on his head when he was out skiing. But so these heavy metals can get in and level out in our brain. Here, this is a great picture here. The color sections of an adult brain indicates areas of volume loss due to lead exposures as a child. So volume, the lead can actually knock those tissues out. So then again, blindness, deafness, brain damage, kidney damage, breathing problems, and cancer. It's just amazing. So traditional testing for heavy metal and chemical poisoning is complicated. Various elements such as hair, blood, urine, and chelation analysis are tested differently. Any one of these tests will not give the best info for all. Using kinesiology and consider other testing options that are available. So I usually use the kinesiology. I think that's very, very important. You can localize it more effectively as well. Do we have heavy metals? Where are they located? What organs do we need to support while we're getting rid of the heavy metal and chemical? And you can do all kinds of neat tests. The hair samples, the hair scans can show us as well. But I find a lot of that's very, very expensive. If we can isolate through kinesiology that there is a layer of infection, then I consider heavy metals and chemicals a layer of infection. So when I'm considering that, I would rather just kinesiologically check. Using a thorough history, thorough examination, I use the Asira or electrodermal screening as well. And you can do as much as you want, but I try to keep the costs for diagnostics down, because I find that if I can isolate it with kinesiology, then I've got the extra funds, if you will, because the patient only has so much funds that they can use for their health care, that I try to use the supplementation to get the look that the treatments that they're wanting. So when treating heavy metal and chemical toxicity, it's very important to look for layers of infection. So I consider them a layer of infection. That's just one of the things I'm considering, along with virus and parasites and bacteria and so forth. Because fungus is often present with heavy metals, it is also important to treat fungus at the same time in order to unlock the connection between them. So it's kind of the fungus and candida and so forth have a brilliance to them. They have a life form, an intelligence. So they want to keep the host connected and protected. So treating fungus at the same time as heavy metals helps us to unlock the metals and expose them to the meta-X for chelation. So let's say that if this Mortadella or Molcoreana, these are the different types of fungi, it'll wrap around and keep the heavy metal from affecting the tissues around the area. So if you're using the Fungex with the meta-X, you're going to break apart the biofilm and the junk that the fungus creates. Now the meta-X can get in, along with Toxex and Integracell, and chelate and bring those heavy metals out of the situation, out of the area. So fungus has an innate intelligence and wants to protect the host from exposure from heavy metals. So they want the host to live. That's one of the reasons why that intelligence drives them around to stop the cellular damage. So we can have millions of cells die. When we're talking about 40 to 80 trillion in our body, we can have millions die off from heavy metals and still live and be fine, but just have all the other symptoms that we've discussed. So again, now treating heavy metal with meta-X allows more effective removal of the fungus. So again, if you're trying to get rid of fungus, think of the heavy metals together. I usually use them together as I'm working. So we've discussed this in previous webinars, but if you haven't been on with this before, these are how we treat our layers of infection. Bacto is for bacteria, Bacto-X. Meta-X is what we're talking about tonight. So here's the picture of a bottle of Meta-X. So this helps remove heavy metal and chemical. Microsite and Paramac are for our parasites. Micro is small. You need to see it with a microscope or other diagnostics. Paramac is large enough that you can see it with a naked eye. It's going to be the size of a pinhead out to a 6-foot-long tapeworm. Fungex works with the fungus, and Virox for virus. Again, in repassing, microsite you usually take for 40 days constant. There is no larval state to it. There's no adult state. It just has a life cycle that you're able to kill with a 40-day application. Paramac, on the other hand, is designed for killing the large parasites who do have adults who lay larvae. So the process of Paramac is 10 days on, 5 days off. And you do that for 4 cycles or 2 months so that you make sure you're not going to have any more larval hatching. So the treatment then, remove accompanying fungus. So that's why we brought this one up above it. So these two together, we want Fungex and Meta-X together. We support the liver and the kidney because we want to make sure that they're supporting, because the metal and the fungus are usually going to be warehoused. They're going to be up the canyon, and as we're up the canyon with our large fire hose cleaning things out of the canyon, and as that drainage comes down the canyon, it's going to ultimately end up into the water treatment plant. So water treatment plant would be the liver, and it's going to send that on down to our sewer treatment plant, would be more of the kidney. So we want to support those because they are what's in charge of chelating, detoxifying, removing, getting them out of us. So we want to support them as well. The Tox-X is a chelating agent. So think about Meta-X as a digger up in the valley. It's going to dig and remove. It's going to get rid of. It's going to pull from tissue. When you're meeting that with Fungex, we're unraveling the connection of the fungus around it. Now we're chelating and bringing it. The digger is bringing it up out of the tissue, up out of the storage. It's removing it from the warehouse. Now it's coming down the river, and it's going to go into the kidney and liver and be worked on and chemically processed. And the Tox-X now acts as a chelation agent to bring small molecules out down the canyon. It's going to make the small molecules become larger. If you hold your fingers out, look at your palm and hold your fingers out away from, so you have a wide open hand. That would represent the kidney and liver net. Now let's say take a pen, because if you're taking notes, well, of course you're taking notes. So take your pen and move your pen through your open fingers, okay? And now bring it back around in front and again through the open fingers. That would be what happens when we get sick, like a Hersheimer's reaction. We're having, people call that herxing, when you have small molecules that can't get caught in the kidney and liver net and excreted. So we put Tox-X in. Now take the pen and with your other hand, your right hand or left hand, whatever, wrap your fingers around the pen and now try to move the pen through your open fingers, and you're not able to do that because your clenched fist with the pen in the middle of it can't move through the opened fingers, that net, that filter. It gets caught in the kidney and liver and excreted and out. That's the idea of chelation. So we're wanting to chelate these toxins, heavy metals, and chemicals out of the system. So that's why the whole process here. Now, the IntegraCell is the most effective, highest quality, most amount per milligram that there is on the market. There's other good companies. One of the multi-level companies out there, I think it's Protandim, has about 900 milligrams, and Protandim gets great result. They're a great company, but it's a multi-level company. Not that I'm dogging on multi-level, but it usually ends up being more expensive. Where you get 900 milligrams per dose, with IntegraCell you get 8,000 of type A antioxidant. So type A antioxidant is different than type B. Type B antioxidant, 1 milligram, will knock out 1 free radical. Type A will knock out 1 million per molecule or per milligram. So 8,000 milligrams times 1 million is 80 billion free radicals that one dose or one scoop will give you. Can you imagine? Holy smoke. That just blows my mind. So anyway, that one needs to be in there. That the IntegraCell must be in this process. And I start out literally everybody as they come in, people that are sick, with IntegraCell. I just send them home here. I want you to take this IntegraCell for 2 to 4 weeks, along with kidney with liver G maybe and whatever else I might feel. Even oftentimes before I start working on layers of infection, because we've got to build their integrity before we can start to, we've got to back flush the filter down in the valley. We've got to get ready for what's going to come down the canyon as we're cleansing and clearing. So I like the IntegraCell to help remove the free radicals and clear things up, so that then when we start to get rid of the layers of infection, our liver and kidney and so forth can handle it. And that's why I usually start with the IntegraCell first. Good stuff, guys. Gotta love it. Okay, so this is basic. Always make sure that you're checking kinesiologically. Don't just give people because you think of their weight. You need to ask them. So Meta-X, roughly 4 per day to remove the heavy metals and chemicals. 2 capsules rising, 2 capsules at bedtime for the liver G. Liver G, you do that upon rising before bed, empty stomach, because it absorbs right in and you bring it right into the liver. It's immediate. Kidney Clear, 4 capsules a day to work the kidney function. The Toxicity, again, support and chelating the heavy metals. And this is a great hidden concept of Digesta. So the Digesta helps to digest biofilm that may hide pockets of heavy metal, especially in the digestive tract. So it may be more effective to take the Digest on an empty stomach, allowing digestive enzymes to work on the biofilm instead of digesting food in the stomach. So Digest is our digestive enzyme that we take with our meals, but also taking an empty stomach helps to absorb in and not only digest the biofilm in the gut, but it's absorbed into the blood supply. And as we've seen in other tests, we've taken people and looked at their blood on dark field microscopy and seen clumping and all kinds of garbage within the blood. Taken Digesta, a couple of Digesta, and in a half hour take their blood again, and it's completely digested. The clumps are broken apart. Things are moving much better. So Digest is a sleeper, if you will, with any time you're trying to break something down that has biofilm or that's encapsulated in a pustule or any kind of walling off of anything. So keep that in mind on Digesta.